Hi everyone, my name is Maha and I go by any pronouns. For this week's workshop, I will be doing a presentation on the topic pneumonia. I'm just going to go over the basics of what the disease actually is, and I hope you guys find it informative. One second. Okay, yeah. Okay. Introduction. Pneumonia is a bacterial disease caused by Streptococcus pneumoniae and Haemophilus influenzae. Let's be clear here, pneumonia is not only caused by bacteria, it's caused by other pathogens as well, such as fungi, virus, whatnot. The main focus of pneumonia first being discovered and first being acquired as a disease was it being bacterial, and more than 30 different types of pneumonia are there, but most common one is bacterial pneumonia. What happens is that it affects the alveoli or the airflow sacs of the lungs, where it either gets filled with fluid or pus. I mean, the fluid being pus, that's what I meant. And it decreases the efficiency of your lungs. Now, let's be clear, Streptococcus pneumoniae is a bacterial pathogen, and Haemophilus influenza is a viral pathogen. It is spread by inhaling droplets, aerosol from infected people and sharing objects with them, which means that it's communicable disease. Of course, it's respiratory, so that counts as well. We also need to remember that pneumonia can either be symptomatic to another or higher level of disease, or it could be a disease in and of itself. Moving on, let's focus on the signs and symptoms. Cough, which may produce greenish yellow or bloody mucus. We need to remember that. Fever, sweating, and shaking chills. Again, a very generalized symptom. Shortness of breath. We'll also talk about how pneumonia is correlated to COVID in a while. We've got rapid shallow breathing, sharp or stabbing chest pain, which gets worse when you breathe in deeply or cough, loss of appetite, low energy, fatigue, nausea, vomiting, especially in small children, confusion, generally in older people. I'll talk about a case study which relates to pneumonia. This happened before COVID, right? This case study happened before COVID, which means that in this case study, which happened, and it is classified as a case study, but talking from a third person's view, what happened is that this woman in her middle age, let's say 50, 55 years, she must be 50, 55 years old, and she acquired pneumonia as a disease, not it being symptomatic. So when she acquired it, it was quite severe because she was part of the actress group, right? And let's say that she had loss of appetite. It was for 2 months straight, she was admitted in the hospital. So she had to change cities in order to get treated medically, like professionally, for pneumonia because her town did not have access to resources for the treatment of pneumonia. So she was admitted in the hospital for 2 months. And she shifted, and long story short, she did recover from it. But it was, I think, very painful for her and her family, especially, and I think it's quite severe. It is quite, I don't think it's factually severe in certain age groups, let's say children, old people, at-risk groups, etc. We'll talk about it more as we move on to the next slide. So what causes more than 30 different types causes of pneumonia, and they're grouped by the cause. In this case, we're considering pathogens for grouping of causes in order pneumonia to be causes disease. We will talk about pneumonia as a symptom or pneumonia as a cause. We'll go into that before. Let's talk about bacterial pneumonia. It's caused by various bacteria. Streptococcus pneumonia, of course, if it's bacterial, it's going to be treated by antibiotics, right? So your body is weakened in some ways, such as illness, poor nutrition, old age, impaired immunity, where the bacteria will be able to work its way through your lungs. If you've used alcohol, smoked cigarettes, rehabilitated, or had surgery, it's more likely that you're going to be infected by a respiratory disease, and the most common one being pneumonia, as we're discussing here. Let's talk about viral pneumonia. Viral pneumonia is caused by the flu and other viruses. We talked about Haemophilus influenzae. That's one of the pathogens that causes viral pneumonia. What we're focusing here is that viral pneumonia is grouped into another category because viral pneumonia cannot be treated by antibiotics, but viral pneumonia can cause bacterial pneumonia. So you need to have a much more complicated and a more brief treatment for such kind of pneumonia. Let's talk about it in terms of COVID. Um, People either acquire pneumonia as a disease or it is a symptom of a much more likely bigger cause. So you're infected by various viruses, right? Get COVID, and COVID causes the disease pneumonia. So COVID is a variant or a pathogen that is causing you to develop a disease called pneumonia. Now, pneumonia can usually also be symptomatic in the sense that you get pneumonia in the process of being treated for COVID. For example, shortness of breath. You're put on a ventilator. When you're put on a ventilator, you acquire pneumonia because of that, because it's a communicable disease, number one. Number two, people are sharing ventilators due to lack of access of it, or maybe it's not sterilized. Don't quote me on that. I'm not sure about the entire process, but I am sure that pneumonia can either be caused in the process of treating COVID or it could be caused because of COVID directly. You know, it's very important to see that your treatment is not contaminating other people. That's why isolation is recommended. It's why quarantine is a is part of a much larger and a bigger picture. Herd immunity, we've all heard of it, right? Now we talk about mycoplasma pneumonia. Now mycoplasma pneumonia actually comes under bacteria because mycoplasma is bacteria. But um, the thing about mycoplasma pneumonia is atypical. Number one, you established this, and the second is that it has somewhat different symptoms and physical signs. This is why it's grouped into another, because the cause of a general bacterial pneumonia is very different from what a mycoplasma does. Another pneumonias are fungi pneumonia. Fungi pneumonia again, fungal infections of fungal pathogens compromise your immune system or your body in such a way that you acquire pneumonia after it. You don't acquire pneumonia because of the pathogen. You acquire it because that infection done by the fungi is somehow compromising your body in order to acquire pneumonia afterwards. Same with viral pneumonia. You get viral pneumonia and you're going to eventually develop a bacterial pneumonia after that. Now, how is pneumonia diagnosed? We're also going to get into complications later on, but chest X-ray, again, X-rays can tell a lot about a disease. So chest X-ray is one. Blood test is to check the infection present, number one, in your blood culture. Number two is the arterial blood gas testing, checks the amount of oxygen in your bloodstream because the amount of oxygen testing, the pus in your body, that will be tested. Sputum culture, again, it's going to be tested. Everything is going to be tested. The material you cough, everything that is abnormal in your body as of now. Talk about sputum culture, the things that you spit out, that you cough out, the greenish yellow or the bloody mucus you spit out will be tested for any diseases. Pulse oximetry is when it detects the amount of oxygen in the blood as you can read. The chest CT scan, I think we've watched enough medical sitcoms to know what a chest CT scan is. We'll talk about bronchoscopy. Bronchoscopy will now the thing for pleural fluid culture and bronchoscopy is to acquire the pus or the fluid in order to test it or for further diagnosis and then for treatment. It's a direct exam, putting a tube, flexible tube to the airways, to the airway passage, and you're going to evaluate and diagnose the lung problem by acquiring the pus. Now coming to the pleural fluid culture, The sample actually is going to be extracted directly through your chest. What's going to happen is that they're going to doctors are going to diagnose and find a place in your chest where they can get a syringe into the pleural area. The pleural area is the skin between the ribs, the skin between the ribs. I think, yeah, that's what's written. Skin between the ribs. They locate where they can acquire the pus, and they will take a syringe and they will excrete it out and will send it to the lab, trying to find out which exact bacteria is causing pneumonia. The diagnosis of pneumonia is quite simple. It's to find out which pathogen is causing it. Of course, physical signs and symptoms are going to tell you that it's pneumonia. Confirmatory tests are going to be done for if it's pneumonia and the variant of the certain pathogen that's causing it. That's also very important. It's how you proceed with treatment, right? We'll focus on that as well. Talking about treatment, mild pneumonia can usually be treated at home by getting plenty of rest, taking antibiotics if you have bacterial pneumonia, drinking plenty of fluids, and if it is treatable at home, but if your body does not respond well as soon as possible, it is advisable to shift to a hospital because it gets more and more contagious and it becomes more and more severe, puts others at risk, puts yourself at risk more as well. At risk groups, like talked about in the case study, the person at risk is someone who's middle aged, someone who's older, someone and children who are way too young. Talk about complications of pneumonia. It really depends on the person's health and age. We can talk about someone with diabetes, for example. Someone with diabetes has a compromised immune system and they have more easier ways of acquiring pneumonia. Now let's talk about this in terms of COVID. People with diabetes or a problem in their sugar levels are advised to take the vaccination with excessive care because an average person's immune system can handle the weakened pathogens that are inserted into them. It really depends on the vaccine you're taking anyway out of Pfizer. So, the thing with people with diabetes is that you need to handle it with excessive care because number one, you have a compromised immune system, right? You have compromised immune system, and the likelihood of you acquiring pneumonia through that weakened variant inserted into your body is high. The chances are high. It's much higher than an average person would do it. That's why you need excessive care. But at the same time, for people with sugar problems or diabetes, it's not advised against them to not take the vaccine. They can take the vaccine, of course. Again, excessive care is required and really depends on what kind of vaccine you're taking, right? I won't be able to advise you on that since I'm not a professional, so please don't quote me on that. Let's talk about possible complications. There is blood poisoning, sepsis. It's very rare, but could happen serious complication. The possible poison in blood. You'll have a lung abscess. It's when people with pre-existing medical history. It's why it's important to analyze pneumonia, looking at your medical history and looking at the severity of it. Person's health and age really matters. So if you have something if you already have a disease that compromises your respiratory system, the chances of you handling pneumonia is going to be very difficult. Not saying it's not treatable, saying it's very difficult. I cannot extend, however, on how alcohol misuse leads to a lung abscess because, to my knowledge, alcohol affects the liver. But of course, it really does going to compromise conversion of tyrosine into phenylalanine. Don't quote me on that. I'm not going to get into the depth of it. There's that. There's pleurisy. It's when the pleura. We talked about the fluid being filled in your pleural area. If it becomes inflamed, then it's going to cause respiratory failure. You have to be admitted into the hospital for treatment if you develop one of these complications. For children also, it's very important for children below the age of 5 to be handled with excessive care because children have, let's say, comparatively weaker immune systems than teenagers and adults do. So children below the age of 5 really require a lot of attention, especially with respiratory diseases. Talking about prevention, it's pretty obvious. Getting vaccinated, quite of course. Vaccinations, let's talk about preventing pneumonia and the flu. Vaccinations target um, pathogens. Basically, when you're getting a vaccine, the body's going to get familiar with the type of variant that's inserted into your body. That variant may or may not cause pneumonia. Um, and it's quite impossible to get all sorts of pneumonia, pneumonical vaccines in order to protect yourself from pneumonia. It's why when vaccinations are done on the basis of preventing you from acquiring a certain pathogen variant, because one pathogen does not only cause one disease, one pathogen can lead to several diseases caused. It's how your immune system handles it, which leads to a certain disease, right? So, of course, you need a doctor to review your vaccination status, and I think you take flu shots every 2 to 3 years. So you need to keep in check with that as well with the changing season. I quite flew like 2 weeks ago. Think I've recovered from it, but there's still some of that cough left. Uh, Make sure children are vaccinated. Like I said, people before below the age of 5 are at a particular risk of pneumococcal disease. Children who attend a group child care should also get the vaccine. The flu shots for children older than 6 months are also recommended. Children before the age of below the age of 5 have relatively weaker immune systems. We do, because they need to be handled with care because still they're in their developmental age. They haven't acquired all the resources in their body yet to fight it. That's why they need those vaccines. Practice good hygiene. I think we've covered that pretty much in the pandemic. Don't smoke. Again, damages your lungs, natural defenses against respiratory infections. Keep your immune system strong. That's quite obvious. I'm not going to elaborate on that. But I hope my presentation was brief and informative. It was quite basic and I did not go into the depths, I realized that, but I hope that it gives you a basic overview of what pneumonia is, and I will see you in the next workshop that I conduct. Bye.